Hey guys, Josh here from All Systems Chiropractic. Today we're talking about breathing, and today is another video in our patient education series. And I think this will be important for people who may be experiencing neck pain, low back pain, may find that they're out of breath throughout the day, they notice they're frequently yawning or sighing, but overall I think this is a great video for pretty much anyone out there. So today we're going to talk about why breathing is important, a little bit about the assessment, as well as some treatment or exercises that you can do to help improve breathing patterns. So one of the biggest things that we see with people, especially those with chronic neck tightness, is that breathing can actually be playing a role into the exacerbation of these symptoms. And the reason being is that oftentimes those with abnormal breathing patterns start to recruit accessory muscles for their resting breathing patterns. For example, those individuals might overemphasize chest breathing. And when that's the case, some of these accessory breathing muscles that typically aren't active during resting breathing, muscles such as the scalenes, muscles that insert onto the shoulder girdle, start to become overactive. People initiate with the shoulders or elevating the chest. It can also contribute to low back pain. The reason being is that there's an important breathing muscle, the primary breathing muscle called the diaphragm, and that inserts underneath the ribs. It actually goes into the low back muscles, the low back vertebrae, and it helps increase intra-abdominal pressure, which is important for stabilizing the core. Also, what could happen is individuals with a breathing pattern, an abnormal breathing pattern, actually might suck in their stomach as they bring up their chest. This is something we call paradoxical breathing, and this is an extreme abnormal breathing pattern, but oftentimes people exhibit this pattern and don't even realize. So the first thing to improve breathing patterns is to first become aware of what your default is. Oftentimes people who are consciously aware of this can initiate proper breathing mechanics. However, once they become stressed or they get going to their daily activities, whether it's at a desk or physical activity, they resort to some of these abnormal patterns. So first thing first is just bringing your awareness to how we should be breathing. And to do this, again, we want to be initiating that belly breath. So it's important to first start by relaxing the hands onto the chest as well as the belly. And we just start by trying to take some normal breaths. And what you should notice is that on inspiration, we recruit the diaphragm, and what happens is the belly expands. The upper chest should be relatively quiet, especially during resting breathing. Next is seeing how the lower ribs are moving. And what should be happening is it should be 360 degrees, so all the way around, expansion of the lower ribs. So to do that, what you can do is just gently rest your hands like this. Again, take a breath. And notice the expansion in all of the directions. Again, chest should be quiet. If this isn't the case, and you notice that you tend to be breathing a lot through the upper chest, you notice perhaps your exhalation is slow, your inspiration is predominating, then there's a couple things you can do. And the first things first is to notice kind of what normal should be. So primarily, inspiration and expiration should be first occurring through the nose. So both inhaling and exhaling through the nose. Secondly, we should be, again, recruiting the stomach muscles opposed to the chest muscles, and breathing should be low and slow. So the first corrective I'll give you is if you're having trouble with initiating from the belly. And we're going to go to that first position. This could be done lying down, as you'll be in a little bit more passive position, but for demonstrations I'll do it from here. And what we do is we breathe in. And when we do that, we just apply a little bit of resistance into the stomach. And what that does is just facilitate the diaphragm because you're pushing in against resistance. Next, if you're unable to recruit some of the lower ribs, you're not getting a lot of movement through there, we'll go back to, again, that position. And it's the same thing. It's adding a little bit of pressure as you take your inspiration. So again, a little bit of pressure. Breathing in and then out. So it's important to focus on breathing the air out all the way, because when you do that, by taking a full exhale, it forces the next breath in to be full, which will help facilitate the diaphragm as well. So if you're still having issues with those couple tricks, what you can do is change the position. So some people find it helpful to lie on their stomach, and then again, start with that low, slow breathing again. What that does is allow you to push in against a little bit of resistance and help facilitate the diaphragm. Next, what you can do is lie on either side, and that focuses on the right side and the left side of the diaphragm individually. So again, lying on your side, one hand gently on the stomach, and again, thinking about breathing into the full 360 degrees. Finally, another trick, if you find that you're still breathing predominantly through the upper chest, is to put the hands behind the head. Lying on your back, hands behind the head, and what that'll do is hopefully take out some of those accessory muscles and force you to breathe through that diaphragm, that nice deep belly breath. So hopefully these corrective exercises are helpful for you, or at least making you more aware of how breathing patterns should be. Once you start to have that normal breathing pattern, it's important to check in throughout the day. Try every hour or every couple hours to just check in on your breathing. And if you notice you're starting to predominantly breathe through the upper chest, just bringing your awareness back to those normal breathing patterns and doing a couple low and slow breaths. From there, it's important to then add some variability to it. So by adding in core bracing, some core training, while continuing to do those breaths, or during your normal workouts, which will be a little bit more reflective of what you do throughout the day. So hopefully you found this helpful. Check the link in the bio for a little bit more in-depth blog post on breathing mechanics and corrective exercises, as well as a link where we'll include these exercises so that you can see the videos as well as a little bit of the descriptions of them as well. Thanks for watching. Hope you found this helpful.